Mouth breathing is often linked to snoring, restless sleep, and even mild sleep apnea. In a lot of cases, we can actually avoid surgery if the treatment is done early enough. The mouth breathing can lead to dental problems like cavities, more gum issues, because it causes dry mouth. Some people think mouth breathing is just a phase. Kids outgrow it. In fact, it's not true. Many kids need help to switch back from nasal breathing. Studies show that kids with sleep disordered breathing often score lower on tests of memory, attention, and learning. When the breathing improves, though, we see grades improving in a lot of the time too. So what can you do if you suspect of mouth breathing? First, I'm Dr. Maria Florou, and this is Mind Your Mouth. I'll be sharing with you the truth about oral health that most people completely overlook. If you're ready to go beyond the basics, challenge the myths, and truly transform your well-being, let's get started. Have you ever noticed your child sleeping with their mouth open? Or maybe they always seem to have chapped lips and wake up with a dry mouth and bad breath. What if I told you that some things as simple as mouth breathing could be actually shaping your child's face, affecting their teeth and messing with their sleep, and even sometimes impacting how well they do in school? Hi, I'm glad you're here because today we're going to unravel the surprising truth about mouth breathing in kids and why it's so much more than just a quirky habit. Throughout this video, I want you to think about your own experiences, maybe even grab a notepad and jot down anything that sounds familiar. And don't be shy. Jump into the comments and share your thoughts or questions as we go along. I'll be answering as many as I can of those comments. I always enjoy actually interacting with you through the comments, so please feel free to do so. Let's kick things off with a quick poll in the chat. Have you ever caught your child or someone you know breathing through their mouth while they're awake or asleep? Just type yes or no, so I know how many people have actually got an eye for that, because sometimes we don't even pay attention to those things. I'm curious how common this is in your community, in your family, in your life. Now let's break it down to mouth breathing. Mouth breathing actually is pretty common and a pretty straightforward thing to see that's happening just by paying attention and tuning in to pay attention to what our kids are doing, or even the adults close to us. We can pay attention to those who mouth breathe versus nose breathe. When we mouth breathe, air comes in and out through the mouth, especially when talking about kids here, especially when the child is at rest or asleep. Sometimes it's temporary, like when they have a cold or an allergy. But for some kids, it becomes a long-term habit. And the reasons are many: nasal congestion, allergies, enlarged tonsils or adenoids, or even just a habit. But here is the kicker. Breathing through the nose isn't just about comfort. It's actually filtering and humidifying the air, which helps the body to use the oxygen more effectively, and believe it or not, guides the way the child's face grows and the jaws develop. So why does this matter so much? Well, when kids breathe through their mouth all the time, what happens is that actually changes the way that the faces form, because imagine that the tongue is actually sitting on the lower jaw instead of sitting on the top jaw as it should. We're talking about long faces forming, narrow jaw, crowded teeth, and even speech issues. I want you to imagine two kids. One of them breathes through the nose and the other one who always breathes through their mouth. So can you picture those two kids? You can actually already start paying attention and seeing some differences on the way that the face is formed, the circles around the eyes, the tired posture with mouth breathers. Try to pay attention. Now that you have the awareness, pay a little bit more attention to it, and you will be able to spot some differences. Over time, their faces can look noticeably different, and it's not just about the looks, but the mouth breathing can lead to dental problems like cavities, more gum issues, because it causes dry mouth. So the saliva is not there to protect the teeth as it would ideally happen when we nose breathe. Plus, on top of that, it can make orthodontic treatments like braces or aligners less effective. So let's just start watching our kids and even adults a little bit more closely, and we can address these issues. Let's just focus in the mouth at this stage. We're not talking about the whole body just yet, but let's focus about what's happening in the mouth when we mouth breathe. So if you look at me and I'm nose breathing, and you look at my jaw, my face, I'm nose breathing, my tongue is at the roof of my mouth, which in fact, it's helping my jaw to stay wide and to accommodate all my adult teeth. So this is what we want. If the jaw sits here, it actually naturally applies a little bit of force for the growth to happen. So when we're looking at kids, we have a very plastic, a very soft bone structure. In most cases, until certain age, this space, we call this a suture, is still open because we're still growing. So when the baby is born, everything is open here in the skull, in the roof of the mouth. And as we see the babies grow, these structures in the skull close, and the same thing happens at the roof of the mouth. That suture closes, and then growth becomes a little bit slower, let's put it that way. When the tongue is sitting on the roof of the mouth, we are actually helping the jaws to expand. Now imagine that you're looking at me and I am a mouth breather, so every time I'm reading, watching something, doing nothing, not talking, I'm like this. My tongue is actually sitting on the floor of my mouth and not on the top. And what happens is that the top jaw actually cages in the lower jaw. So if I don't develop well my top jaw, I'm not going to develop the bottom jaw, because the bottom jaw has nowhere to grow in most instances. In some instances, depending on genetics, your background, your ethnicity, we're going to see a little bit more of that jaw forming like this, because the tongue is actually putting pressure on the lower jaw, and it's stretching the lower jaw and making it grow. And we ended up with this profile instead of this. But in most cases, especially with Caucasians, we tend to see that everything becomes very crowded and the jaws become very narrow. So that's one of the points that I want to make when we're talking about nose breathing versus mouth breathing. When we look at general health, we also see that when we inhale air through the mouth, so if you do this, just do it with me as you're watching. Can you feel how much air you have coming in? Now, let's focus on, so the amount of air, the volume of air that the body has to deal with and break down and absorb is quite different. So we're actually causing a stress in our body when we mouth breathing. Mouth breathing should only happen if we're doing an exercise that really, like, you're struggling to breathe through the nose and then you use the mouth, because ultimately we want you to have enough air going in. So now let's talk about sleep. Mouth breathing is often linked to snoring, restless sleep, and even mild sleep apnea. When kids don't sleep well, they can wake up tired, cranky, and even trouble focusing at school. And we see this very commonly. Some kids even get labeled as having behavior issues or ADHD, when really, in fact, what they've got is that they're not resting at nighttime. Their sleep is so disturbed because the body's constantly trying to breathe in an optimal way, and they're having to deal with all this when they should be resting. So the nervous system is always active and trying to look for survival, ways to survive through having good air, good quality of air, and dealing with all that air at nighttime. So what should we be looking for? Here are some warning signs. Snoring, noisy breathing at nighttime and sometimes daytime, waking up with dry mouth, sleeping with the mouth open, chapped lips, crowded teeth, long, narrow faces. Or even if you're noticing any of these or one of these, it's already a good sign for you to look for help and inform yourself better on what can be done. Okay, so let's get a little bit more interactive. Grab a mirror and check your child's mouth posture and observe them, pay attention to them when they're not aware of what you're doing. So what I do a lot in the practice, as soon as I see the parents coming in with their child, I'm paying attention as I'm talking to them, as I'm interacting with the family, I'm looking what is the child doing, and as I'm communicating with the child, is actually the child breathing through the mouth, through the nose. Sometimes I need to sit down with the parents and the kid, and I'm asking questions about their health and behavior and other things. And I'm always looking at the child and paying attention, how is breathing going? The other thing that we do, we give our kids when they come in a little bit of water for them to swallow, because I want to see how swallowing is going. Are they actually struggling to swallow? They have to involve other muscles of the face in order to swallow. These are all indications that the tongue is not actually doing what it should be doing. It's not sitting where it should be sitting in order for the swallowing to happen. So come with me. Let's swallow together. Have a little bit of sip of water and see what are you doing, and then start paying attention to your child. What is your child doing? So when I'm swallowing, I'm just going to swallow a little bit of saliva now. This is what I'm doing. We see the movement coming here, but my face is not actually moving. But for kids and a lot of adults, when the tongue is not doing the full movement because the tongue is not trained for it, we see that the other facial muscles are actually getting involved. So this is what I see a lot, because we're trying to seal everything to assist with the swallowing happening. Is the tongue resting on the roof of the mouth? And that's a natural place where the tongue should be sitting. It might be a time to have a deeper look and seek for help, and see if you have a dentist close to you or myofunctional therapist who can actually help you identify those things. Real quick, your mouth is the gateway to your overall health, and at Casuarina Dental, our focus is on you. If you're ready for a holistic approach to dental care, book your appointment now via the link in the show notes. Now, back to the episode. So here is the fun thing. The body is really, really wise, and the tongue is actually a natural orthodontic appliance. It naturally helps the jaws to expand when it rests in the right place. So when it's resting at the roof of the mouth, it can actually help jaw growth, tongue posture, swallowing. A lot of things get influenced by the posture of the tongue. But if the tongue drops down, it's because we're mouth breathing most of the time. The palate can become high, narrow, leading to crowded teeth and bite problems. Now, I know what you're thinking. What causes all this? Why are we actually seeing so many people with low tongue posture and narrow jaws? There are a lot of reasons for it. One, and which is a big one nowadays, is when we're thinking about allergies. Allergies happen for many different reasons. One thing that I always like bringing to the attention of the parents when they come in and I see a patient, a child that's constantly coughing, constantly with a blocked nose, or has the tendency of becoming sick more often than their siblings, I'm thinking, what is it that's really happening? When we mouth breathe, there's no filtration. So all the dust, all the bacteria, the fungi, everything that's in the air, it's actually inhaled. There's no filtration. With the nose, we have hair, we have a specific anatomy to stop things from getting into your body. While the nose is also warming and humidifying the air, it's filtering a lot of stuff that comes when we breathe in. But when we're breathing through the mouth, our first point of defense are actually the tonsils. The tonsils are part of our immune response, and they're the first ones to suffer from that. On top of that, we end up having more allergies and more diseases happening, especially colds and other things. So it could be important to consider seeing an allergist or pediatrician or even an ENT specialist to help you assess your child. What we see happening a lot nowadays is that children will have either the adenoids or tonsils reshaped or even removed in order to allow better breathing, in order to open a little bit that space for the airways. Other things that influence the mouth breathing and jaw formation are anatomical factors. So if we have a tongue tie, the tongue is actually, if just to make sense of what a tongue tie is, so the tongue should be here and it should move in quite good range. If we have a skin that ties the tongue to the floor of the mouth, so if we can't do this because we see a strong skin pulling the tongue down, that's considered a tongue tie. There are lots of different variations on tongue tie, but just to keep it simple here. And what that does is it doesn't allow the tongue to do its full function for eating, drinking, swallowing, and sometimes even speaking. But now, what comes first, right? The chicken or the egg? When do those problems start? We know that there is a big talk about breastfeeding versus bottle feeding and other things. But there is a combination of factors. I don't like saying that things are caused just because of one reason. Most of the time, we have more than one thing that comes into play, and we see mouth breathing happening. What is important about the conversation that we're having here today is to be able to identify those things and to be able to seek for help, or even find some good home alternatives that you could be doing just by bringing the awareness back to your child. Let's breathe through the nose. If they have patency, if there's enough space for the air to go through the nose, we should be really re-educating and retraining our brains to do so. Otherwise, we should look into seeing an ENT or a dentist or a pediatrician to help identify possible causes and retrain and help to reestablish nose breathing, because we can, with the right tools, reestablish healthy nasal breathing. Now, I'm curious to know your thoughts about this. Have you ever thought that the mouth breathing could actually be affecting academic performance? Have you ever thought of that? Have you ever thought of how your child's concentration is going at school and how the grades are going, and how that can be actually influenced and impacted by mouth breathing and struggle to rest at nighttime? Studies show that kids with sleep disorder breathing often score lower on tests of memory, attention, and learning. When the breathing improves, though, we see grades improving in a lot of the time too. If you're seeing a turnaround in your own child after addressing this, please let us know. Share your story, because your story may actually help other parents and other people to improve what's happening with them too. So what can you do if you suspect of mouth breathing? First, get a proper evaluation. This might mean seeing a dentist, an orthodontist, a pediatrician, or an ENT. Sometimes myofunctional therapy, and that's a lot of what we do with our patients, we help them retrain the tongue and the muscles around the face. And that actually helps with sticking to new habits, because sometimes we see kids that have had surgery, but they don't know. It's like someone who walks with a stick, and all of a sudden they have certain treatment and they don't need the stick anymore, but they still maintain a certain posture. So with kids, when we address nose breathing, we address tonsils, adenoids, is this enough? Sometimes it is, sometimes we still need help to reestablish a healthy nasal breathing and the muscles so we teach the muscles where they should sit for optimal growth and development. So let's make this practical. Maybe set a reminder for you or a timer for bedtime so you can get up and go and have a look at your child. And now you know what to look for. You know what to watch. Are they breathing quietly? Is the mouth open? What's happening there? You probably have noticed those things already, but if you haven't, go and check, because that can have a big impact in their growth and behavior and development. So in our practice, we have a lot of stories about people who have actually gone through all this that we've just discussed, and they have applied the treatment that we recommend. Normally, what we need to do with kids after appropriate assessment, we educate them on muscle posture, we educate them on breathing, and we need to work with certain appliances specific to be worn with certain appliances that specifically help with growth and assist the body in achieving the results that should have been achieved with proper tongue posture. In a lot of cases, we can actually avoid surgery if the treatment is done early enough. So we need to take this into account, because what we hear a lot, especially from certain professionals, is that, oh, we should wait until all adult teeth are in place in order to treat. Do you really think that that's appropriate after all this conversation that we're having here today? If we wait until all adult teeth are in place, as I was showing you before with the model, if we don't have enough expansion, how the teeth that come with this predetermined size are going to fit on a jaw that's smaller than what it should be? We'll end up, if we wait, we'll end up having to remove teeth in order to make the other teeth fit the jaw. But that's what we're willing to avoid. We try to avoid having narrow upper airways, narrow jaws, in order to accommodate all teeth and to have better breathing and better performance in general. Now, let's bust a few myths. Some people think mouth breathing is just a phase. Kids outgrow it. In fact, it's not true. Many kids need help to switch back from nasal breathing. Others believe it only affects teeth. But as we've seen, it can actually affect sleep, it can affect allergies, it can affect immune response and growth, and a lot of other things. And just because the child sometimes does not snore, it doesn't mean that that's all clear. We still may have mouth breathing happening, but it's a silent mouth breathing. So go there, have a look at your child, and keep an eye so we can actually seek appropriate health when needed. Throughout this video, I want you to remember mouth breathing is common, but it's not something to be ignored. Early action can make a huge difference in your child's health, confidence, and happiness. Keep asking questions, keep sharing your stories, and keep supporting each other. If you found this video helpful, please hit like, subscribe, and share it with someone who might need this information. And don't forget to drop your questions and comments. I really want to hear from you. Thank you for joining me in this journey. And remember, sometimes the smallest habits can have the biggest impacts. So let's keep this conversation going. Thank you for tuning into Mind Your Mouth. These episodes have been created for you. If you found this conversation helpful, the best way to support the show is by leaving a 5-star review on Apple Podcasts and Spotify. And don't forget to subscribe on YouTube so you never miss an episode. For more tips on holistic dental health, follow me on social media at Casuarina Dental. In the meantime, take care of your smile, take care of your health, and I'll see you in the next episode.